My name is Eduardo Toledo. I am mechanical engineering by Universidad Nacional de Ingeniería of Peru and Master in Biomedical Engineering at Politecnico de Milano. Currently, I am Deputy Manager of Maintenance at the Peruvian Social Health Insurance. This work is entitled Asset Management Evaluation in the Peruvian Social Health Insurance System. The Social Health Insurance Salud is a public agency of the Ministry of Labor and Employment Promotion of Peru, which provides health service with unlimited coverage to payroll personnel of public and private companies through 32 autonomous decentralized bodies, ADB. Maintenance Deputy Management is the central body regulating and supervising hospital maintenance management in the Peruvian Social Health Insurance. Asset management in E-Salud comprises 389 healthcare facilities and 56,464 hospital equipment for more than 11 million of insured people. Before we present the proposal, we're talking about the hospital equipment. As we can see in the first pie chart, 77% of them are biomedical and the rest are electromechanical. Regarding to operability, 92% are operative equipment and 8% are inoperative. Regarding to warranty, 87% have no warranty and 13% have warranty. Then, in the last pie chart, only 38% of the equipment are within useful life. This information will allow us to adequately establish the indicator's targets. The proposal consists in to carry out the management evaluation with 5 indicators. The information was obtained from the institution's computer systems. They are SAP and SISMEC. The indicators were established in percentage format as follows. Equipment operability is calculated by dividing the total quantity of operative equipment by the total quantity of the equipment, and its target is more than or equal to 90%. Budget execution is the execution of the maintenance budget with respect to the available budget at the beginning of the year, and its target is more than or equal to 100%. Preventive maintenance compliance is the number of preventive maintenance performed among the total planned preventive maintenance, and its target is more than or equal to 80%. Percentage of unplanned maintenance is calculated by dividing the total quantity of corrective maintenance performed by the total quantity of maintenance activities, and its target is less than or equal to 10%. Cost of service ratio is calculated by dividing the total annual cost of operating an equipment maintenance program by the value of the equipment in the inventory, and its target is less than or equal to 5%. The proposal has the following objectives. First, to evaluate the results obtained by the 32 autonomous decentralized body in the 2020 through the 5 maintenance management indicators. Each ADB provides healthcare service in a geographic region of Peruvian territory. Second, to identify ADBs with management deficits and those that perform adequately. Thirdly, to carry out differentiated strategies activities for each ADB, which will allow improving and optimizing their management. From the evaluation carried out for all ADB through descriptive statistic and data classification by quartiles, it has been possible to determine the best value indicators. They are marked in green. The worst value indicators, they are marked in red. The average value that represent the value indicator for E-Salud as institution, they are marked in blue, and the standard deviation. The result of the equipment operability indicator is relatively low due to the fact that there is a significant amount of equipment that is inoperative, beyond repair, and needs to be decommissioned and is awaiting the asset retirement process. The budget execution indicator result in 2020 showed its lowest value compared to other years due to the COVID-19 sanitary emergency. There's a high variability and high standard deviation of the cost of service ratio indicator due to the fact that several of the ADBs do not carry out adequate resource planning. As a consequence, they continue spending the same amount of maintenance, considering the historical costs without analyzing nor evaluating its needings. Finally, preventive maintenance compliance indicator is related to percentage of unplanned maintenance indicator because a greater amount of unforeseen work causes the personnel to be unable to comply with the maintenance program, and therefore there is a greater allocation of man-hours in corrective maintenance. A strategy of selective and unknown supervision was determined for the group of ADBs with diverse results. They are Cajamarca, Huancavelica, Huaraz, Juliaca, Moyobamba, Pasco, Puno, and Ucayali. This strategy will be implemented by the maintenance deputy management through a program of on-site supervision visits for each ADB in order to audit and evaluate its management through documents as work orders, payment conformities, parts and service requirements, etc. A strategy of reinforcement and accompaniment was determined for the group of ADBs with the poorest results. They are Ancash, Cusco, Ica, Junín, Loreto, Revaliati, Sabogal, and Tacna. This strategy will be carried out through a training program for engineering department provided by the maintenance deputy management. Then, management results will be evaluated each month to verify whether the indicators have improved. Thank you so much for listening to me. If you have any question, please, you can send us an email to me or to my colleague. We will be happy to answer your questions.